Hello, this is Lilibet Encarnacion Hernandez, and for today we have the unit number 60. The name is Case Presentations. We're gonna be seeing a couple things such as what is it and how doctors use it in a consult with their patients. Now let's see the introduction. And let's begin with what is a section of a case presentation. So, in a case presentation, a doctor presents the details of a patient's case to a college at a clinical meeting in a hospital. A typical case presentation is divided into the following sections. So here we have it. We have the section and we have the example language. In the section 1, we have the introduction. For example, I'd like to present Mr. Simpson. Then we have the patient's age and occupation. A 34-year-old plumber. Then we have presenting symptoms and duration. This is who presented with a 1 month history of breathlessness. Then we have associated symptoms. He also complained of ankle swelling, which he'd had for 2 weeks. Past medical history. There was no relevant past history. Social history. He was married with 1 son. He smoked 25 cigarettes a day and drank about 50 units of alcohol per week. Family history. His father died of myocardial infarction at the age of 42, and his mother was alive and well. We have now the findings on examination. On examination, he was obese. Investigation results. We did a chest x-ray, which showed, now we have the diagnosis. So we thought he had treatment. We gave him intravenous furosemide and then we have the outcome or what happened. And the example language is he responded to treatment and was discharged home. Okay, we have seen this part. So let's see now what is bedside presentation. This is included in this type of presentations. So this is a less formal type of presentation and can take place at a patient's bed. For example, during guards rounds, when the house officer presents a new patient to the consultant, or in a teaching guard round, when a medical student presents a case to the tutor. This type of presentation begins less formally than the other. We have an example over here. This is Mr. Simpson. He's 34 and he is a plumber. He came into hospital yesterday, sent by his GP. He's complaining of breathlessness, which he has had for 1 month. Let's see now the slides. What is a slides here? So is a formal presentation with the main points and are usually summarized on slides. For example, right here we have SH. Example, married with 1 son, 25 cigarettes per day, 50 units of alcohol per week. We have the PH, nil relevant. We have the FH of family history. Father died, 42 MI, mother MWK. OE, obese, 2 spider, navi and chest. We have the P, 110 per minute, and the VP, 160. And then we have the CXR, and example, enlarged heart and pleural effusions. Let's begin now with the exercises of Unit 60. So it says, write the abbreviations in words, look at A and see opposite at the appendix number 2 on page 131 to help you. It's just completed with the main significant. So we have the C/O, it is complaining of 2/52, 2 weeks. PH, past history. FH, family history. MI, myocardial infarction. BP, blood pressure, 112, 1 month. NIL or nil, nothing. SH, social history. A&W, alive and well. OE, on examination. And CXR, chest x-ray. This is the same as we saw previously. In this case, it is a little note that they use to summarize the slices or the record of the patient. In this, we have it this over here. Now let's see exercise 60.2. Put the sections of a short informal case presentation in the correct order. Look at A opposite to help you. And then we have exercise 60.3. It says, read the presentation below and make notes for a slide. Look at C opposite to help you. Let's begin. In the exercise number 1, the way I did it, it's order, section of presentation and corresponding sentence. Number 1, introduction. We begin with Mr. Collins is a 60-year-old security guard. Social history. He smokes 20 cigarettes per day and drinks 15 to 20 units of alcohol each week. In presenting symptoms, on routine questioning, he said that he had a morning cough with small amounts of white septum for many years. He produced once some strokes of blood in the sputum. Number 4, we have the past history. He had no relevant previous medical history. Duration of symptoms or history of presenting a complaint. He presented with a 6-week history of pain in the leg. We have associated symptoms. The pain, which was localized around the ankles, had been increasing intensity and was associated with local tenderness. And last one, number 7, findings on examination. We have, on examination, there was marked tenderness around the lower legs above the ankles, and on examination, except for clubbing on the fingers, there was crackles at the left base posteriority in the chest. There was nothing used abnormal to find on examination except for clubbing of the fingers. This was the exercise 60.2. Let's now see the exercise point 3. Oh, there's still missing one from the exercise point 2. So we have investigation results. We have chest x-ray showed consolidation in the left lower lobe. Bronchoscopy and biopsy showed adenocarcinoma of the lung, and computed tomography or CT scan showed that it was not resectable. And last one, yes, number 9, treatment and outcome. Treatment with chemotherapy was resulted in temporary improvement in the chest x-ray, but the leg pain has continued to prove difficult control. Exercise 60.3. Make notes for a slide. So here is a summary for Mr. Marcy's case organized as notes for a slide. We have the section and the slide notes. In the CO we have Mr. Nemata, 63 years old, taxi driver. SOV 312, history increasing dyspnea and ankle swelling, chronic cough with purulent sputum and occasional hemoptysis. We have the PH or past history, partial gastrectomy in 1980, and we have the OE. We have pale leg edema, not clubbing, lymphadenopathy, and the BP apraxia or normal, and abdomen, liver palpable 5 centimeters below costal margin smooth, and non-tender scar firm, previous operation. Perfect. So we have just finished with this unit. I hope you have enjoyed it. Thanks so much.